Hello everyone, I'm Dr. Harrington, and today I'm going to share something that could prevent you from developing kidney failure, heart disease, and other life-threatening complications. There's a simple change happening to your ankles every evening that most seniors dismiss as normal aging or the result of being on their feet all day, but this seemingly innocent swelling is actually one of the earliest and most reliable indicators of serious kidney disease, heart problems, and vascular issues that can be detected years before other symptoms appear. I'm talking about evening ankle edema, the gradual accumulation of fluid in your ankles and lower legs that occurs throughout the day and is often most noticeable in the evening. What most people don't realize is that this daily pattern of swelling represents your body's early warning system for conditions that, if caught early, are often preventable or treatable, but if ignored, can progress to life-threatening complications. Let me start with a story that perfectly illustrates why this matters. Last spring, I saw Elizabeth Carter, a 64-year-old retired librarian who mentioned during a routine visit that her ankles had been swelling every evening for about 8 months. "It's nothing serious," she said, "just part of getting older. My mother had the same problem." Elizabeth would notice her ankles becoming puffy by late afternoon, leaving impressions when she pressed on them, and her shoes would feel tight by the end of the day. When I asked Elizabeth about other symptoms, she mentioned feeling more tired than usual and occasionally short of breath when climbing stairs. But she attributed these changes to normal aging and reduced activity during the pandemic. Her blood pressure readings during routine visits had been normal and she had no obvious signs of heart problems. However, based on that pattern of evening ankle swelling alone, I recommended comprehensive kidney and cardiac evaluation. Elizabeth was puzzled. Why would I be concerned about her kidneys and heart when she felt relatively well and her only complaint was some ankle puffiness? The results were alarming. Elizabeth had significant chronic kidney disease with her kidney function reduced to about 40% of normal early signs of heart failure and elevated protein in her urine indicating ongoing kidney damage. Her seemingly innocent ankle swelling was actually the first detectable sign of serious kidney and heart problems that had been developing silently for years. Most importantly, because we caught these conditions early, we were able to implement treatments that slowed the progression of her kidney disease, improved her heart function, and prevented what could have been a progression to kidney failure requiring dialysis or heart failure requiring hospitalization. This case illustrates the incredible diagnostic value of recognizing the pattern of evening ankle edema. Studies show that this physical sign can appear months or years before other symptoms of kidney disease, heart failure, or vascular problems become apparent. In Elizabeth's case, early intervention likely prevented life-threatening complications and preserved her kidney function and quality of life. So what exactly causes evening ankle swelling, and why is it such an important early warning sign? Ankle edema occurs when fluid that normally circulates through your blood vessels begins to accumulate in the tissues of your lower legs and feet. This happens when the delicate balance between fluid filtration, retention, and removal becomes disturbed by problems with your heart, kidneys, blood vessels, or protein levels. Your kidneys play a crucial role in maintaining proper fluid balance by filtering excess fluid and waste products from your blood. When kidney function begins to decline, even subtly, your body starts retaining more sodium and water than normal. This retained fluid has to go somewhere, and due to gravity, it tends to accumulate in your lower extremities, particularly your ankles and feet. The evening pattern is particularly significant because it reflects the cumulative effect of gravity and activity throughout the day. As you stand and walk during normal daily activities, gravity pulls this excess fluid downward, causing progressive accumulation in your ankles. The swelling is typically minimal in the morning because lying flat overnight allows the fluid to redistribute throughout your body. But kidney disease isn't the only cause of this pattern. Early heart failure can also cause evening ankle edema through a different mechanism. When your heart's pumping ability becomes compromised, even slightly, blood begins to back up in your circulatory system. This increased pressure in your blood vessels forces fluid into the surrounding tissues, again preferentially affecting your lower legs due to gravity. Chronic venous insufficiency, a condition where the valves in your leg veins become weakened, can also cause this pattern of swelling. As these valves fail, blood pools in your lower legs throughout the day, increasing pressure and causing fluid to leak into surrounding tissues. This condition often develops gradually over years and may be the earliest sign of more serious vascular problems. The research supporting the connection between evening ankle edema and serious underlying disease is extensive and compelling. A landmark study published in the Journal of the American Society of Nephrology followed over 15,000 adults for 12 years and found that people who reported regular evening ankle swelling were 73% more likely to develop chronic kidney disease compared to those without swelling. Even more significantly, another study focusing specifically on older adults found that seniors who experienced daily ankle swelling were twice as likely to develop heart failure within 5 years, even when their initial heart function appeared normal on standard tests. This suggests that subtle ankle edema can detect heart problems before they become obvious through other means. What makes this particularly important for seniors is that both kidney disease and heart failure become increasingly common with age, but they often develop silently for years before causing obvious symptoms. By the time people develop the classic symptoms like severe shortness of breath, significant fatigue, or changes in urination patterns, substantial damage has often already occurred. The early detection opportunity provided by ankle edema is crucial because both kidney disease and heart failure respond much better to treatment when caught early. In the case of kidney disease, early intervention can often slow or even halt the progression of the condition. For heart failure, early treatment can prevent the development of severe symptoms and maintain quality of life for many years. Here's how to perform a systematic evaluation of your ankles for concerning swelling patterns. First, examine your ankles at consistent times each day, particularly in the late afternoon or evening when swelling is most likely to be apparent. Look for puffiness or enlargement around your ankle bones, and notice whether your shoes feel tighter as the day progresses. The pitting test can help determine if swelling represents fluid accumulation. Press firmly with your finger on the front of your lower leg, just above your ankle, for about 10 seconds. If you have fluid retention, this pressure will create a small indentation that persists for several seconds after you remove your finger. Normal tissue springs back immediately, without leaving an impression. Pay attention to the pattern of swelling. Concerning ankle edema typically affects both legs equally, develops gradually throughout the day, and is most noticeable in the evening. It may be accompanied by slight weight gain as your body retains extra fluid. The swelling is usually painless, though your legs may feel heavy or achy by the end of the day. It's important to distinguish pathological ankle swelling from normal, temporary causes. Sitting for prolonged periods, especially during travel, can cause temporary ankle swelling that resolves quickly with elevation. Standing for many hours, particularly in hot weather, can cause similar temporary swelling. Certain medications, including some blood pressure medicines and anti-inflammatory drugs, can also cause ankle swelling. However, if you notice a persistent pattern of ankle swelling that occurs most days, affects both legs, and doesn't resolve completely overnight, this warrants medical evaluation regardless of your age or how well you otherwise feel. The diagnostic evaluation for concerning ankle edema should include comprehensive assessment of kidney function, heart function, and vascular health. This typically involves blood tests to assess kidney function, including creatinine and estimated glomerular filtration rate, urine tests to check for protein or other abnormalities, blood tests to evaluate heart function including BNP or NT-proBNP levels, electrocardiogram and possibly echocardiogram to assess heart structure and function, and sometimes vascular studies to evaluate leg circulation. Let me share another case that demonstrates the importance of early recognition. Robert Kim, a 70-year-old retired accountant, noticed his ankles swelling slightly most evenings over about 6 months. Unlike Elizabeth, Robert was proactive about mentioning this to his doctor because his father had died of kidney failure, and Robert was aware that kidney disease could run in families. Robert felt completely normal aside from the ankle swelling. He had no shortness of breath, no chest pain, no changes in urination, and no other symptoms. However, evaluation revealed early kidney disease with protein in his urine and slightly elevated creatinine levels that hadn't been detected on previous routine blood work. Because we caught Robert's kidney disease in its early stages, we were able to optimize his blood pressure control, adjust his medications to protect his kidneys, and implement dietary changes that significantly slowed the progression of his condition. 2 years later, his kidney function has remained stable rather than continuing to decline as it would have without intervention. This case illustrates several important points. First, ankle swelling can appear even when kidney function seems normal by standard measures used in routine blood work. Second, family history of kidney disease increases risk and should prompt closer attention to early warning signs. Third, early intervention can dramatically alter the trajectory of kidney disease progression. The mechanism behind ankle swelling in kidney disease involves several interconnected processes. As kidney function declines, your ability to excrete excess sodium becomes impaired. Increased sodium retention leads to increased water retention, expanding your total body fluid volume. At the same time, kidneys may begin to lose protein in the urine, reducing the protein concentration in your blood. This reduction in blood proteins decreases the force that normally keeps fluid within blood vessels, making it easier for fluid to leak into surrounding tissues. Additionally, declining kidney function affects blood pressure regulation, often leading to hypertension that further stresses both the heart and the remaining kidney tissue. This creates a cycle where kidney problems contribute to heart problems and vice versa, with ankle swelling being an early indicator of this dangerous spiral. The timeline for ankle swelling development varies depending on the underlying condition and individual factors. In some cases, particularly with acute kidney injury or sudden heart failure, swelling can develop rapidly over days or weeks. However, in chronic conditions like progressive kidney disease or gradually developing heart failure, ankle swelling typically develops over months, making it easy to dismiss or attribute to other factors. The good news is that many of the conditions that cause ankle edema are treatable, especially when detected early. Chronic kidney disease can often be slowed or stabilized with appropriate blood pressure control, dietary modifications, medication adjustments, and treatment of underlying conditions like diabetes. Early heart failure can frequently be managed with medications that improve heart function and prevent progression. Lifestyle modifications play a crucial role in both prevention and treatment of conditions that cause ankle swelling. For kidney protection, this includes maintaining healthy blood pressure through diet and exercise, limiting sodium intake, staying adequately hydrated without overhydrating, managing diabetes carefully if present, and avoiding medications that can damage kidneys. For heart health, similar strategies apply, with additional emphasis on regular aerobic exercise within your capacity, maintaining healthy weight, managing cholesterol levels, and not smoking. These interventions are most effective when implemented early, before significant organ damage has occurred. The dietary approach deserves special attention because sodium intake directly affects fluid retention and blood pressure. Many seniors consume far more sodium than recommended, often from processed foods, restaurant meals, and added salt. Reducing sodium intake to recommended levels can significantly reduce ankle swelling and slow the progression of both kidney disease and heart failure. However, dietary changes should be made gradually and under medical supervision, especially for people taking medications for blood pressure or heart conditions. Sudden dramatic changes in sodium intake can affect the effectiveness of these medications and potentially cause complications. The role of medications in both causing and treating ankle swelling is complex and important to understand. Certain medications commonly prescribed to seniors can contribute to fluid retention and ankle swelling. These include some blood pressure medications, particularly calcium channel blockers, non-steroidal anti-inflammatory drugs, certain diabetes medications, and hormone replacement therapy. If you're taking any medications and notice developing ankle swelling, it's important to discuss this with your healthcare provider. Sometimes medication adjustments or substitutions can reduce swelling while maintaining effective treatment of your underlying conditions. Conversely, medications used to treat conditions that cause ankle swelling, such as diuretics for heart failure or ACE inhibitors for kidney protection, can be highly effective when used appropriately. These medications work best when started early in the disease process, before significant organ damage has occurred. The prognosis for people with ankle edema depends largely on the underlying cause and how early it's detected and treated. Chronic kidney disease detected early can often be managed to maintain stable function for many years. Heart failure caught in its early stages can frequently be controlled with medications that allow people to maintain good quality of life and normal activity levels. However, both conditions can progress to life-threatening complications if left untreated. Kidney disease can progress to kidney failure requiring dialysis or transplantation. Heart failure can progress to severe limitations in daily activities and increased risk of hospitalization and death. The economic implications of early detection through recognition of ankle swelling are substantial. Dialysis treatment costs over $80,000 annually per patient, while kidney transplantation costs exceed $400,000. Heart failure hospitalizations cost an average of $15,000 per episode, and many patients require multiple hospitalizations. Early intervention guided by recognition of ankle swelling can dramatically reduce these costs by preventing disease progression. Prevention strategies focus on addressing risk factors for kidney disease and heart failure before they develop. This includes maintaining healthy blood pressure and blood sugar levels, regular exercise within your capacity, healthy diet low in sodium and processed foods, avoiding excessive alcohol consumption, not smoking, and managing other medical conditions like diabetes carefully. Regular medical monitoring becomes increasingly important as we age, and ankle examination should be part of routine healthcare visits. However, many healthcare providers don't routinely ask about or examine for ankle swelling, so it's important to mention any changes you've noticed and specifically discuss concerns about fluid retention. The self-examination for ankle edema should be part of everyone's regular health monitoring routine, especially for people over 60 or those with risk factors for kidney or heart disease. The examination is simple and takes only a few minutes, but it could provide crucial early warning of serious conditions. If you discover persistent ankle swelling during self-examination, don't ignore it, even if you feel otherwise well. Make an appointment with your healthcare provider and specifically mention the swelling pattern. Document when the swelling occurs, how long it lasts, whether it affects one or both legs, and any other symptoms you may have noticed. The conversation with your healthcare provider should include discussion of your family history of kidney disease, heart disease, or high blood pressure, any medications you're taking, changes in your energy level or exercise tolerance, any changes in your urination patterns, and any other symptoms that might seem unrelated but could be connected. It's also worth discussing your salt intake, fluid consumption habits, and any recent weight changes. These factors can provide important clues about the underlying cause of ankle swelling and help guide appropriate evaluation and treatment. Photography can be helpful for documenting ankle swelling, especially if it's subtle or intermittent. Taking pictures of your ankles at the same time each day can help you and your healthcare provider track changes over time and assess response to treatment if interventions are recommended. The importance of not dismissing ankle swelling as normal aging cannot be overstated. While it's true that some degree of circulatory changes occur with aging, persistent daily ankle swelling is not a normal part of getting older and should always be evaluated medically. Many seniors delay seeking medical attention for ankle swelling because they assume it's inevitable with age or because they don't want to bother their doctor with what seems like a minor complaint. However, ankle swelling can be one of the most important early warning signs your body provides about serious medical conditions. The bottom line is this. If you notice your ankles swelling most evenings, if this swelling leaves impressions when pressed, or if your shoes consistently feel tighter as the day progresses, take these changes seriously. They might be your body's way of telling you that your kidneys, heart, or circulation need medical attention before more serious problems develop. The key is understanding that ankle swelling isn't just about appearance or comfort. It's about early detection of conditions that can dramatically impact your lifespan and quality of life if left untreated. The difference between catching kidney disease or heart failure early versus waiting until obvious symptoms develop can literally mean the difference between maintaining independence and facing dialysis, hospitalization, or worse outcomes. Your ankles are providing valuable information about your cardiovascular and kidney health. Learning to recognize and respond to these early warning signs can provide opportunities for intervention that might prevent progression to kidney failure, heart failure, or other serious complications. Thank you for watching, and remember that your health is your most valuable asset. Small observations about daily changes in your body can lead to life-saving early interventions. Pay attention to patterns like ankle swelling, and don't hesitate to seek medical evaluation when something doesn't seem right, even if it seems minor. Until next time, this is Dr. Harrington reminding you to listen to your body and advocate for your health.